Alright, I had to take a little pause because the camera overheated and now I had to reset up so that we could try and merge some things together. But we are at the point now where we have already taken off plasma for everyone. So we've gone down, uncapped, taken a pasture pipette, taken off everything we can, down as close as we can, put it into the aliquot tube, recapped, and we've done that for everybody. Everyone that we're testing. So now we're to the point where we're going to drop reagents into everything. First though, we have to make up our cell suspension, which is a 3 to 5% suspension. And we need to wash it, which is something that I forgot to tell you the other day when we were doing that video. Light year, light year. So you want to put enough cells in here that they'll wash without having any issues, because when you wash, you're going to lose some of the cells. So this is a dog, and you want enough behind that you can make a 3 to 5% suspension. And the reasons that we need to wash our cells, especially if you work at a pediatric facility and you're testing babies, cord bloods have Wharton's jelly in them. It's this thick, goopy stuff that can cause false positive reactions because it causes the cells to auto-agglutinate. Another thing that could cause cells to auto-agglutinate is excess protein, like from Waldenstrom's macroglobulinemia or any of the other diseases that could cause a high protein level. So now we're going to wash these. So you want to fill the tube about a little more than that, about 3/4. And then you want to get all the cells in there without purposely hemolyzing them. But you want to rinse out your pipette and get everything mixed up. Put your pipette in the biohazard trash. Put your cell suspension in the centrifuge. And again, mix it up. Get all the clumps so that you have a free-flowing cell suspension so that you can wash off all the junk. Last one. And you will find at some hospitals that they don't wash first. And most of the time it's not a big deal. But if you get some unexpected reactions and you haven't washed your cells, that's the first thing you need to do, is wash them and see if there's something in there that shouldn't be. Alright, so we're going to pause while we centrifuge for 60 seconds. And the centrifuge is slowed down. We're just waiting for the beep. And then we're going to decant. And you can see we've got everything washed. So this is tube and dog. We're just going to turn these upside down in the biohazard bucket that has absorbent material in it. So just upside down, boop. And yes, we lose some, which is why we said to put a little extra in. So this is dog and tube. And now we have the other two. They look the same. Decant. And resuspend, mouse, and light year. And now we're ready to drop the rest of our reagents and get things rolling. Alright, so remember, oh, no we're not. you got to keep me in line here. We need to make 3 to 5% suspensions of everything. And you see these drops down here on this absorbent towel? That's fluid on the outside of these from washing. That's why you have a safety shield in place to protect you. So you're going to resuspend these at approximately 3 to 5%. They look nice and pretty and fresh, don't they? And those look good. So again, we've got tube in the back, dog is next, light ear is next, and then mouse. And you want to make sure that you always have your things in order, right? Okay, so now we are going to drop our reagents. And you'll notice that we had everything lined up so that all the anti-A's are in a row, or a column, whatever you want to call it. So we're going to drop our anti-A, mix it up, make sure you mix what's in the dropper, 1 drop into each tube that is labeled anti-A. Same thing with anti-B. 1 drop into each tube labeled anti-B. Same thing with anti-D. 1 drop without touching the tubes. Get your hand-eye coordination going. And then we're going to drop the clear liquids in the back type. Remember that the patient plasma needs to go into all of these. 2 drops of patient plasma into each one. And light ear is next. One, two, 1, 2, 1, 2, 1, 2. And yeah, I do talk to myself. Dog is next in the 3rd row. And then fill the tube is in the back row. So